Symptom monitoring. We all have a role in keeping our campus community safe. Everyone must notify the college and not come to work or school if you have even mild COVID-19 symptoms, fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, a sore throat, congestion or runny nose, nausea or vomiting, diarrhea. Someone in your household is positive for COVID-19, or you have been in close contact within 6 feet for at least 10 to 15 minutes with someone who is positive for COVID-19. Use BHCC's online symptom self-report form. Use this link to report to the college if you are experiencing symptoms. Link is posted on BHCC Reopen website. For faculty and staff, information is received by Human Resources, who notifies the appropriate supervisor. For students, information is received by the Dean of Student Affairs, who notifies the appropriate instructors. COVID-19 testing. Current Commonwealth of Massachusetts guidelines require all symptomatic individuals and anyone else in close contact with a positive case to be tested for COVID-19. The state has free testing sites for anyone experiencing symptoms. The list of sites is at the following link. See your doctor to arrange a test. Remain at home until you receive test results. Do not return to campus unless you have a negative test. Notify the college if you are positive for COVID-19. BHCC then notifies the Massachusetts Department of Public Health of any positive cases to conduct contact tracing. All of your contacts on campus will be notified. Any of them who have been in close contact will need to obtain a test. Quarantine. Commonwealth of Massachusetts guidelines. If you are not sick and have not tested positive but are a close contact to someone diagnosed with COVID-19 or recently returned from any travel outside Massachusetts, you must self-quarantine until you have a negative test to help stop the spread of COVID-19. While in quarantine, separate yourself from others in case you get sick. Stay at home and use a separate bathroom and bedroom if possible. Do your best to stay at least 6 feet away from other people in the house. Do not leave your house to go to school, work, or run errands. Do not have any visitors to your house during this time. Wash your hands frequently with soap and water for at least 20 seconds. Do not share eating or drinking utensils with anybody. Monitor your health every morning and every night or any time you feel like you might have a fever. Take your temperature. Be alert for any symptoms of COVID-19, including fever, cough, or shortness of breath. If you need to seek routine medical care, call ahead to your doctor and tell them you are under COVID-19 quarantine. If you have a medical emergency, call 911. Tell them your symptoms and that you are being monitored for COVID-19. Do not take public transportation, taxis, or ride shares to get to your appointment. The quarantine period. If you have a negative test or do not show signs of COVID-19 for 14 days after the last time you were exposed, your self-quarantine period is finished. Your last day of exposure is the last time you're within 6 feet of someone confirmed to have COVID-19 or the day you arrived home from travel. Isolation. Commonwealth of Massachusetts guidelines. If you get sick during self-quarantine or are sick and a healthcare provider tests you for COVID-19 or are told by a healthcare provider that you have COVID-19, you must then self-isolate to help stop the spread of COVID-19. While in isolation, stay at home and use a separate bedroom and bathroom if possible. Stay at least 6 feet away from other people in the house. If you get sick with fever, cough, shortness of breath, or other signs of respiratory illness, call your healthcare provider and tell them if you have been exposed to COVID-19. If you have a medical emergency, call 911. Tell them your symptoms and that you have or may have COVID-19. If you need to see your healthcare provider, do not take public transportation, taxis, or ride shares to get to your appointment. Do not leave your house to go to school, work, or run errands. Do not have any visitors to your house during this time. Wash your hands frequently with soap and water for at least 20 seconds. Do not share eating or drinking utensils with anybody. Cover your mouth and nose with a tissue or your sleeve, not your hands, when coughing or sneezing. Clean surfaces that you touch every day with a household disinfectant. Make a list of everyone you have been close to within 6 feet for at least 15 minutes since you first got sick. Those people have been exposed to COVID-19 and should be asked to self-quarantine. The isolation period. For students or staff coming out of isolation after being ill with COVID-19, they can return to the campus as follows. At least 24 hours have passed since recovery, defined as resolution of fever without the use of fever-reducing medications, and improvement in respiratory symptoms, e.g., cough, shortness of breath, and at least 10 days have passed since symptoms first appeared. For persons who never develop symptoms, isolation and other precautions can be discontinued 10 days after the date of their first positive test. We all need to do our part to protect our college community. All of these measures, symptom monitoring, testing, quarantine, and isolation, are essential to prevent the spread of the COVID-19 virus on our campus. We are relying on everyone to observe these guidelines. Thank you, and stay safe. Please check the BHCC website at the following links for updated information and guidance. Send your questions and comments to reopen@bhcc.edu.